stop you from speaking, asking questions, or making comments. So without further ado, good afternoon, everyone. My name is Yolanda Mack. I am with the Greater Newark Healthcare Coalition, and I am the manager for community health. And I'm excited to see you all on here. Thank you for taking time out because I know we're all busy doing different work in our respective areas, but we greatly appreciate you coming on here at Greater Newark Healthcare Coalition. So I just wanted to come on and initially start. You got this massive email invitation of us inviting you to come on and hear about. Your email may have said redetermination. Some might have said insurance work group. But just to give you a little background, and before we jump in and before I introduce my executive director, some of you might have heard the term planning and unwinding, redetermination, cover all kids. And just to give you a quick snapshot, since March of 2020, which we know was COVID, New Jersey Family Care, Medicaid followed special rules. And because of the pandemic, which was the public health emergency, a lot of the rules allowed for most people to not have to renew their eligibility, which meant they got to keep their insurance for the last few years without having to recertify. And as the public emergency comes to an end, New Jersey Family Care, they're going to have to follow those normal federal rules again. And it's expected to begin April 1st. And what that means is everyone that has NJ Family Care, which is, and when I use the word NJ Family Care, that's the Medicaid for coverage for the state of New Jersey. So what's going to happen is everyone's going to have to re-enroll. And there are a lot of different moving parts in this. And our job as one of the regional health hubs also is to make sure that we're getting the word out and spreading awareness so that people don't fall through the gaps. So what does that mean for all of us here as well as you? We all work with people in different areas. And our job is to make sure that we have the same information as well and sharing it across all of the different networks. For logistic purposes, just so you know, my colleagues, they're going to be dropping also a link in the chat where you can complete the questions that are in there. That's going to help us figure out how to move forward, possibly in smaller work groups going in the future. So my colleague will drop that in the chat for you, just so you know to look for it. I also like to acknowledge some of our key players here that we've already had the wonderful experience of working with. Horizon, we have Evelyn Acevedo, we have Iris Cooney. Get familiar with these names, guys, because they are the major players in trying to assist us, or rather not trying, but they are assisting us in enormous ways. And I just wanted to shout out a few of their names. I also have Laura Waddell from New Jersey Citizens Action. I also see Eileen Ingram Willis, she's from Volunteer Lawyers for Justice, another awesome organization. And I don't want to shout different people. We also have one of our board members, John Jacoby, he's on from GNHCC. Quite a few people on here, too many to read and move across the screens. But what I'm going to do now is I'm going to allow my executive director, Carrie Lagoso Muserel, she wants to share as well. You're on mute, Carrie. Well, we can't hear you. Turn your volume up. Okay, so no volume. While Carrie gets that to together, hold on one second, guys. Technical difficulties always come up, but that's not an issue. Yes, and then
I think I'm back. Is that
Okay,
better?
you're back.
Oh, God,
Great.
sorry about that. All right, I tried to do it through my phone to minimize noise, and I minimized too much noise. So sorry. All right, so thank you, Yolanda, and thank you everyone for being here. I won't take up too much time. I wanted to just add in a little context to this conversation. As Yolanda said, Greater Newark Healthcare Coalition is convening this as part of our work as one of New Jersey's 4 regional health hubs. We have sister hubs in Camden, Trenton, and Paterson. And what that means is that New Jersey Medicaid works very closely with these 4 hubs, asking us to work locally to support state priorities such as insurance access. And they provide funding locally through us, to us and through us, and also Medicaid claims data. So we are positioned well to be a bridge between the state and our local network to achieve some common goals. And part of that work means we're asked to convene, which Yolanda has clearly accomplished with over 40 people here, neutrally convening partners who are in the work in different ways. And then to co-create with the local partners local response. So our topic today is, and our goal today is to start the work together and start designing solutions to this. I'll call it an opportunity. It is also a challenge about this redetermination experience we find ourselves in, and also something the governor has afforded us, which Yolanda has a slide deck she's going to walk us through, Cover All Kids expansion of coverage for 19 and younger, regardless of immigration status. So that's a big opportunity for us. And then collection of qualitative data is something that we want to put out there for all of you to know about. We are asked to surface through you and with you experiences on the ground so that we can bring those back to Medicaid and other state partners to inform continuous quality improvement. So that's a big opportunity. And then quantitative, data. So like coming up with some agreed upon metrics about impact and success measures so that we can understand together how we're doing locally to ensure people are covered. So that's kind of the high level opportunity we have here. We expect funding, there's some funding opportunities here to fuel the work. And then there's some other infrastructure like the staff you see here from Greater Newark, and then other like data that we're going to be able to bring to this conversation through Medicaid and by pooling our work on the ground. So with that, I thank you again, and I'm going to turn it back over to Yolanda. There's opportunities for us to ask questions and to have discussion, obviously, throughout today, but I'll pause there and give it back to you, Yolanda.
Thank you, Carrie.
You're welcome.
So we're going to get started. I have a short presentation that I just want to walk you all through. And please remember, in the chat, there's a link for you to fill out some, click on the link and fill out the information. It's going to, like I said, help us to make some informed decisions as we move forward in this work and how we can all, have a great impact overall. So without further ado, Gemma, yes, thank you. Gemma is my co-host. All right, so we're going to do a quick overview. NJ Family Care, we already know that NJ Family Care is the Medicaid for New Jersey. I also want to just pivot there really quickly to let you know who the players are. So we have Horizon, which we have representation on the Zoom today. We also have WellCare, we have Workgroup, we have United, and then Aetna. So those are the 5 players that when people are re-enrolling or enrolling for the first time, that's who they have access to. So I've already mentioned that the New Jersey Care Family Redetermination begins on April 1st, which is around the corner, right? Because it's already the 22nd. New Jersey will have 12 months to re-enroll everyone who is eligible in family care. And then we also have Get Covered New Jersey for those who are income ineligible for family care. And we already know that there are you know, a certain number of people that are not going to be income eligible because at the time they may have, because of COVID, lost their job, family structures changed, so they won't qualify and they'll have to go out onto the Get Covered New Jersey, which is the marketplace, and get insurance from there. Then we have Cover All Kids, which is exciting because in the state of New Jersey, the goal is ensuring all children under the age of 19 have insurance. And the great and wonderful thing is it's regardless of immigration status. So what does that mean? That means literally children, regardless of their immigration status, can get health insurance. The parent may not, but the child can. So it's important that we know that. I see a lot of different organizations on in terms of you may work with children or in the school field. So we'll be creating something specifically for you as well to make sure that we're capturing all those children as well as anything out in the community. Next slide, Jimmy. So here you can see we have a chart that's reporting data, and this data was based on children under 19 that didn't have insurance as of 2020. And if you look at it a little more closely, you'll see that based on you have number of insured and the number of uninsured. And that's what we want to focus on, the uninsured, and getting people that don't have insurance at all insurance. But keep in mind, we also want to make sure that those children that have insurance get re-enrolled. So that's why we have a lot of different moving parts going on. The other thing is, if you look based on, Newark has different wards. We have the North, East, South, West, and Central. And then we've also included Irvington and East Orange because they are part of the greater Newark area. So just looking at the chart, and I don't want to bore you by just reading numbers, but you can see that 17th, the highest number of uninsured is in the East Ward of Newark. So that's a focus area that we will want to focus on and see what we can do to ramp up children getting enrolled in that specific area. And the next highest area is the West Ward of Newark, which shows 8.8%. And then I'll just mention one or more. The next one is East Orange, which is 7.35%. So as you can see, it begins to decline down, but the major thing is all children should have insurance, and that's what we want to do. So that's with the initiative. If you hear CAK, that stands for Cover All Kids. Next slide, Gemma. So why are we here? So one of the goals, we listed a few goals, and we want to minimize the number of currently insured people who lose insurance due to this family care redetermination. So we've already mentioned that people have to re-enroll and get redetermined. And what does that mean? And I'll leave that question later on for some question and answers, since we have some of our key players here. But ultimately, people should have already gotten a package in the mail from the state of New Jersey, from Medicaid rather. And we're finding out that a lot of people either didn't know what it was, so they didn't start the process. And it's our job as a regional health hub to make sure that we capture and allow, as we don't want people to lose insurance. So that's why we're all convening today. So just always keep that in mind. We want everyone to maintain their insurance. And even if they can't get family care, we want them to be able to be a part of the Get Covered New Jersey as well. We also want to reduce the uninsured rate among the greater Newark residents, right? So we know that we have people that are uninsured, and we want to get insurance for them because we know that that's how people can assume their, wellness. And if they don't have insurance and they're not visiting primary care doctors or getting specialty care, then it becomes a major cost to the system overall. Next, we want to increase the number of children under 19, which is the Cover All Kids. So I know we have, a few different acronyms, but just remember Cover All Kids is very important. And even the sensitivity of that, because we're talking about being able to get insurance for people that are undocumented. So we also want to make sure that we're handling that with care when we're speaking to people, to make sure that they know the benefits of their children, and just be sensitive about it, because people are still afraid and have fear. So we want to diminish that fear. And it's important that it comes from organizations like ours that are already in the community, boots on the ground, and working with people so that they can feel the safety of getting their needs met.